Hi guys, it's Mark here from Newbie Prepping. I hope everyone's okay. So, calling this video how to, trying to give you some tips and advice from what I've gathered and picked up on how to avoid the coronavirus, how to go through the process of if you caught the virus, and how to cope during the course of the potential closure of stuff or just quarantine. So the Singapore Prime Minister has come out and done a video, done a YouTube video for his country, and I feel this is an excellent state of play for a Prime Minister to do. I've got the link below, and he's basically saying that it's coming and they need to be prepared. It's really good that a Prime Minister is having the foresight to acknowledge it's going to come and it's going to affect everyone. Well, not everyone, but you know what I mean. And it's a pity more countries are not doing this. So that's one link. Obviously, there's the other links as well down below of the other people where I got the sources from. Obviously, Dr. David Campbell, if you've not subscribed to his channel, the link below. And he's in this link below, he's describing how this is where it gets confusing. So the World Health Authority is changing the name again. Right, so it was Novel Coronavirus 2019, NCOV/2019. Then they changed it to COVID-19 because that's the actual disease. But now it's got a new name, which is SARS COVID-2. Now, how are we going to follow all these? We're getting so many different names now. Why couldn't they just stick to one name? Now, as you've probably seen on some of the other videos, there will be a link below, which has been put up by YouTube, what goes straight to the World Health Authority to get the latest information. It's supposed to be updated every day, and it didn't seem to be. You do get. I know they're giving the basics of what's happening, but they could actually do a bit more, I think. You know, but powers that be, you know. So let's see now. We go through this, you know, step by step. So how to avoid getting it. Now, this is not solid gold advice, because you could be anywhere and someone you not know, you catch it. If you know that this should be quite obvious, if you know that there's an area which has the coronavirus, don't go there. You know, the taxi driver, the person who comes with the taxi driver who picks up our eldest girl, her nephew is going over to Brighton. Hello! I'm sure he'll be safe. He believes he will be. But why put yourself into that situation? Just don't understand it. But each their own. It's not something that I would do, and I feel sorry for those who live in Brighton. But your trade will be affected, because no one in their right mind is going to go to a place what's got the virus. So don't go to a place what's got the virus. Try to avoid airports. Now, I understand that people got to go to work and they're going to have to go on trains and public transport, but just be careful. If someone's sneezing, you know, try and make sure they're not sneezing just in the air, because as in the diagram, obviously large droplets will fall straight to the ground. Smaller droplets can go up to 2 meters, and very small droplets of the virus can stay in the air for, you know, I think it's 30 meters. So that's a good contagious area where you potentially could catch something. So I can see it's going to get to a point where a lot more people are going to start wearing masks, you know, to try and avoid catching stuff. So don't go to places where you know where there's a virus unless you really need to. Obviously, if you live in the areas, then you need to travel around. Try and avoid airports as much as possible. I feel sorry for people in London, but the underground is not the world's best places to be in when there's a virus going. But try and avoid the underground. Trains, buses where it's really packed. If you're going to work, leave that like 15-20 minutes early. If the bus is packed, wait for the next one. You know, it probably, hopefully, will be less people on there. I know that would happen with quite a lot of trains. Everyone wants to get on the first one because they've got to get to where they're going. Just wait for the next one where there's less people on there. It might stand a better chance of not catching something. So these are some little bits what could help you prevent you from getting something. And obviously, if you have got a cold and you're sneezing, coughing, into a tissue, throw it away. You know, because obviously, if people see that you're taking those precautions, it would make people feel more at ease. And I did see one YouTube video. There was a Chinese woman on the train, and people were around her was going like this. Are you stupid? Are you that stupid that your clothes are going to stop a virus like this? Guys, what are you thinking? You know, not every single Chinese person has got the virus, or Oriental person was on the train. Do you know what I mean? It's like the person who brought it into England was an Englishman. It was a white man. You know, so don't discriminate because you don't know who's got it. Just because you're on the train and there's a Chinese person or an Oriental person in front of you, it doesn't mean, if they're Oriental looking, it doesn't mean they come from China. Doesn't mean they got the virus. Yeah, and it could be anyone. So let's not victimise people because anyone could have it. In Brighton, a doctor's got it. Do you know what I mean? So you're going to avoid all doctors now? No, you're not. So there's some little tips to avoid places. So how to protect yourself. When you get home, wash your hands. Warm soapy water has been the recommended thing. Hand sanitizer. You know, I know both me and my wife rub our hands after being out somewhere. And they're quite small now. It's about so big. Just carry one in your pocket, coat pocket, and especially if you go into a public toilet, there's so many germs there anyway. You know, wash your hands, hand sanitizer, really get in between your fingers, and hopefully, fingers crossed, you should be fine. Hopefully. Don't sue me if you're not. So here's another link to a Channel 4 little documentary. Is Britain ready? The answer to it is no one's ready. You know, you can plan everything, but if we just haven't got the beds, you know, and no government's going to purposely build a quarantine hospital ward or whatever just in case. They've got a good idea it's going to come, but they will tackle it when it comes. So that's a little documentary. Do watch it. Also, is another link, CNBC, which was the last video I just watched. It was out on the 15th, and obviously they reported the death toll at the moment is over 1,500, which is sad. Confirmed cases is 67,000. 67,000. It's a lot confirmed, and I know it's still rising. It jumps up because there was a new way of them detecting the virus, which is, I'm not a medical person, and I would love for a medical person to say if a CT scan can detect a virus in someone's body, because I didn't think it could. I think it could see symptoms, but you don't know if they've got the virus or if they just got pneumonia. Do you know what I mean? So not everyone with pneumonia has the virus. So I would love someone to comment below if a CT scan can detect a virus in the body. The amount of confirmed cases in England is 9, still quite low. Now, I know there have been some more people on the Diamond Princess who's been confirmed having the coronavirus, or COVID-19. It's crazy, you know, because so many people are catching this, and this from earlier videos. What I said, the rate of how quickly this is spreading, you know, then they've been like quarantined in their rooms. Now, is this still from the first person who had it, or is this spreading between each other somehow between cabins? I don't know, you know, but there's, you know, is the entire ship infected from this? These people who come off first? It's quite concerning, really. And there is another report. It's not peer reviewed, and it's mentioned in the CNBC news that there's, as I said, it's not peer reviewed, so it's still waiting. If it's ever gonna get peer reviewed, because obviously it's not a good sign that the R rate could be higher. So there's in this paper it's saying 4.7 to 6.6, which is even higher than what I was even saying from at the beginning in earlier videos. So that's concerning, and potentially someone could be contagious up to 22 days. You know, that's a long time. And I know in Japan that they've found the driver who had the original person in Japan the very first person who had the coronavirus. They was in his cab. He's been tested positive for having the coronavirus. Now, this is where it gets very scary, because he didn't know, and now he's already been tested. Last week he was in, I believe it was last week, he was at a party where there was over 100 people. The amount of work that the Japanese CDC equivalent is going to have to do now of tracking 100 people down and who they've come in contact. There's been a suggestion that Japan could have an epidemic there now, a silent epidemic of this, you know, and that's quite scary now. So that's 2 countries what could have the epidemic, and we still don't know about like Africa or South America. Is it they're not being tested? Is it? Do you know what I mean? There's no cases, which is really strange, even though there's a lot of Chinese people working in these countries. For them to have no cases whatsoever. you know, it's one of those ones. So yeah, but if you enjoy these videos, if you're not already a subscriber to us, please subscribe. Hit that bell button for notifications as we do more videos, and we'll keep you up to date with other stuff, what comes up regarding this, and generally prepping for whatever may happen. So the other one is how to get the information that you need. Now, yes, I know you're watching this video, but you need to broaden it. So there would hopefully by the time you watch this, there will be the World Health Organization banner, what takes it straight to their page. But the one link would be Dr. David Campbell, which tells you the medical side and cases and how it's affecting people. There's like your local news and genuine news outlets. They will all be sufficient in telling you what's going on locally. So I know there was a case in London, a Chinese woman come from China. So obviously I'm not saying avoid London because everyone's got to work, but try and limit where you go. Another place to get information from. Now, he does do a lot more talks about non-peer review papers, but he has been quite accurate on quite a lot of stuff, but also been in front of the mainstream as well. And that's Peak Prosperity, link again down below, and that's another one where it's quite good to get a bit more foresight into the future. So there's quite a lot of places there where you can get information from. Just want to remind you that we have a Discord channel, and you're more than welcome to join us, and that should be whizzing around about here. You're more than welcome to join us and get some latest videos and gossip with like-minded people. I just wanted to go over one last news report, and this news report's from Taiwan. Now, I do get that Taiwan and China are not best friends, but there's reported now what can't be confirmed really, that if you catch COVID-19 for the second time, it seems to be a lot more lethal. The report and the article should be here. The website link will be down below, and have a read for yourself. I don't know, it's not been mentioned at all. I know it has been questioned, once we've had it, are we immune to it? And no one seems to have really answered. This is a problem with a new virus, no one really knows, and it does create fear by not knowing. But this is where we should try and find information like this and be prepared for it, you know. If you're prepared, you're more likely to do the right thing. If you're not prepared and you panic, you're liable to do the wrong things, you know. So I would love the government to turn around and say, this is what's happening, this is what we're going to do if XYZ happens. But they're not going to do that. They're going to wait till something happens, then do XYZ, and everyone's going to go, oh, what's happening? But I think that's enough for me. It's 2:30 in the morning on the 15th now. So I will be trying to get another one out maybe over the weekend, and you see me again, this ugly mug, on Monday. So have a nice weekend. From me, from Newbie Prepping, it's Mark saying good night. Hi guys, just a little bit of a bolt on to the actual video, what we've been done. So I actually sent this to Rich a day after filming the last little bit. One of our Discord members sent a link which has got a lot of information on there about the coronavirus, so I thought we'd just quickly add that on. So the link will be below, and that's the image. So again, be safe out there, and we'll be doing an overnight camp this Friday, Saturday, so that's going to be up in the Glen Chain. If you fancy coming along, leave a message and get in contact. So maybe see you then. If not, a new video will be coming up next week. Bye.